More just keeps coming. We've talked about studies that suggest those weight loss medications significantly reduce the risk of heart attacks and strokes, as well as reducing the risk of dementia, addiction, and other mental health issues. And now there is another one that touches the lives of many right here in Louisiana. Yet another study is suggesting there is another benefit to those weight loss injection medications. This time, the findings include lowering your risk of more than a dozen types of cancer when you're on the GLP-1 injection known as semaglutide. Brand names include Ozempic and Wegovy.
We've known for a while that next to tobacco, obesity is the next largest risk factor for several cancers, for a lot of cancers.
We asked the director of the LSU LCMC Health Cancer Center, Dr. Lucio Mille, to explain the study in JAMA Oncology. He says obesity causes chronic inflammation, which damages your DNA or genetic code, and it suppresses your immune system so it doesn't clear out early cancer cells. It promotes the blood supply to feed cancer, and it makes insulin less efficient. So more insulin in your blood feeds cancer cells. So do we see more cancer here in Louisiana because of our high obesity rate?
Some of the cancers for which Louisiana's statistics are far worse than the national average are associated with obesity. The reason why that's dangerous is because we're starting to see younger women, like very young women, who develop endometrial cancer on a background of obesity.
There are still some unanswered questions like, can this class of medication be used as a preventive strategy? But doctors have known for some time that you and your doctor should talk about a strategy, a plan to help you stay at a normal weight and prevent type 2 diabetes.
Preventing obesity, and especially preventing the metabolic consequence of obesity, is in fact a major way of reducing one's cancer risk.
Right, so the doctor said there need to be more follow-up studies to this, right?
Always, because this was a study looking after people had lost weight. So it's not only about using the medication for prevention, that needs to be researched, but the researchers always say the medication may be associated with a non-significant increase of kidney cancer, but previous studies found them to be kidney protective. So of course, more clarity is needed, and that's what science does. It builds on the study before it and just keeps building.
I know a lot of people are talking about this, so I know that more studies that come out and the more that we know about it, they may feel better about taking it.
Absolutely.
All right.